Whenever you get treatment also, you can sit in this posture, cross your legs and close, lock your hands. Last week, someone has asked, that while treating, her energy was drained out. After the meditation session, briefly, I'll explain what is the reason behind that. Okay. And all the therapist has to protect your aura by 2 points. I'll explain what it is. Okay. Now, please sit straight. Let your vertebrae be straight. Totally relax. Legs crossed. Hands locked. Close your eyes. You have to simply watch your thought. Flow of thought is nothing but mind. Bundle of thoughts is mind. When we observe, when you see the mind, when you witness the mind becomes silent. It will disappear. Don't allow any thoughts to crop up. Don't allow any thoughts to crop up. Please keep on observing the mind. Mind becomes silent. When mind becomes silent, it cannot take you haywire. You will gain a grip over your mind instead of mind having a grip over you. When mind becomes silent, we will come to presence, because mind cannot take you to past or future or chattering or planning, whatever it is. Will completely stop. Automatically, our parasympathetic nervous system is activated. When mind is silent, our parasympathetic nervous system is activated. When parasympathetic nervous system is activated, all the secretions of enzymes and hormones is at optimum level, including the happy hormone dopamine. You can sleep well, you can digest well when parasympathetic nervous system is activated. Our perception level will improve. When we practice this every day, you will come to know that there is a seer in you who is seeing the mind, who is witnessing the mind. It is called prajna, awareness. Try to stay there, sthita prajna. When you are in presence, you are with the divine energy, which is available only in present, not in the past nor in the future. When we are with the divine energy, when we are in the present, we are supported by the divine energy. All our decisions is supported by the divine energy. Friends, when we meditate, we will not commit any sin, because you observe the mind, flow of thought change. Even if by mistake some evil thought comes, when you observe it, it is modified. Watch your thought. Don't entangle with the thoughts. Don't allow any thoughts to crop up. if you practice this every day, you will slowly come to know that your true self is the witness consciousness, which is witnessing the mind. That is our true self. Though we possess our body, though we possess our mind, though we possess our intellect, that is our possession. That is not our true self. The true self of our true nature is the witness consciousness within us, which has got no birth or no death. Don't allow any thoughts to crop up. Practice this every day. Friends, now gently rub your palm, make a cup out of it, close it on your eyes, slowly open your eyes. Friends, in the previous session, someone has asked, is it true that we are affected by negative energy of the patient at times because they have experienced it? It is really true, because energy, the human energy, bioenergy, Chaitanya, always any energy flows from higher to lower. Imagine you are traveling in a vehicle, you are sitting next to the driver. By chance, if you go to sleep, sleep means in. Your in energy becomes powerful. If the driver's yang energy is weaker, he will get affected by that and he will go to sleep. Because energy flows from higher to lower. That is why it happens even while treating patients. We have to protect our aura, our energy, our kvi, our chaitanya. How can we do it? Friends, we have to improve our thai yang. Thai means maximum, yang means circulation. Because yang protects from external pathogenic factors. Highest density of energy is available in yang. That is represented by SI and UV meridian are called Taiyang meridians. Either you can tone SI1 Jingwell point and UV67 Jingwell point, or SI3 and UV62. Or according to Dr. Wall also, control measurement point of small intestine and UV meridian, if you can 1B tone it, our yang will improve. Nobody can disturb us. No energy can disturb us, or no pathogenic factors can disturb you. Okay. Anyhow, this is not the platform to discuss more about it, because last time somebody has asked this query. I'm telling you, I'm very glad to invite our beloved young budding Professor Uma Rao for this session. She has got adequate experience, more than 4 or 5 decades of experience in teaching and in acupressure field. She has got more than 5 years of experience. She has conducted many online and offline awareness programs and teaching for our semester classes through our samsthan. I'm very proud, because she is a product of our Ishan, Bangalore. Friends, I'm sure you'll be enthralled by her teaching on fundamentals of color therapy. Color therapy is very, very simple and useful to treat most of the common diseases. You'll all be benefited. Whatever you learn, try to apply and see the miracle happen. Because the person who is going to teach you has a command over the subject. We are all blessed to have Professor Uma Rao amidst us. And on behalf of every one of you, again, I extend my invitation and hand over the class to her. Welcome, Umaji. You can take charge.
Thank you, sir. Just a minute. Okay. Good evening to all of you. Yes, good evening to all of you. I request all of you to kindly mute yourselves. Just a minute. I'm trying to. Yes. Yeah. So welcome to all of you, and thanks to the Ravindra sir for having given me this opportunity to address all of you. And yes, so uh, today we'll be seeing about color therapy. And since you're all students of acupressure, I think you will find it very easy to understand. Just a sec. I want to disable the chats for the time being. Yes. Yes. So when you have doubts, I'll take it after some time, and we'll just go through the session. So today we'll be doing the basics of color therapy. And though, yes, I do have a lot of teaching experience of about 4 decades, I'm still an amateur as far as acupressure is concerned. And thanks to Ravindra sir and some of the miraculous cures he has done, I got interested and enrolled into the acupressure courses. I have completed my 5th semester. And in the last semester, I also taught the first year TCM course. And since teaching is in my blood, my class may look like a regular teaching class. So if I sound like a teacher, kindly I request you all not to take offense, because I'm used to asking questions, etc. And let me see how I can make this whole concept of color therapy very simple to all of you. And firstly, color therapy. Yeah, kindly don't ask me questions in between chat. Somebody asked me, are you sir's sister? Please, it distracts me because the chat keeps popping up. Let's take that up in the end. And so color therapy, I think first I was introduced to color therapy by Anil Mishra sir. And if any of you have attended Rizvi sir's class, so in almost all his protocols, he has some points with color. So he doesn't use only color therapy, and he gives a mixture. So that was when I was really interested in this. And I started using it for children, and I found it very effective. And let me frankly tell you, I have not treated any serious illnesses with this, but for quite a few common kind of problems we have, issues we have, I have found color therapy to be very effective. And from my experience, some people respond excellently to color. I'm still, trying out to know what is the body constitution which makes people respond to color. And some of them, they say it doesn't help them and they want to have magnets. Anyway, that I think as therapists, you should try out and see what works for a patient. But when you're traveling or with children, it's always easy to have a pack of colors, and you can treat yourself and the people around you. So I'll be sharing my screen, and we will start with this. Yes. So nice colorful first slide full of colors. And before I start, I want to place on record my gratitude to SPS and to Ishan, and to all the gurus, some of whom I have named here, for having taken me through this wonderful, experience of acupressure. Now, I love this quote by Dr. B.M. Hegde. There is no pill for every ill, but there is an ill following every pill. So this was something which really interested me to look for alternative ways of treatment for at least common problems, and also, as a support to treatment when something is unavoidable. Like, for example, supposing, somebody is highly diabetic and they're already taking medicines. So is there some way we can supplement this in such a way that, their constitution doesn't deteriorate, and they need not go on increasing their tablets, say from 500 mg metmorphin to 1000 to 1500 to 2000, and finally land with insulin injections and so on. So, and from the beginning, we have always been using homeopathy, and homeopathy is also a way of treatment where it is holistic. And so I think that is the most appealing thing about acupressure, that you don't treat the body separately. So even if you have done your first semester, I think most of you would have at least completed the first semester, you will see that, you have emotions, and you have seasons, you have mental conditions, you have physical conditions, everything associated with organs, associated with energies, and so on. So we are not isolating, and treating separately. So as a
Your
therapist,
voice is cracking.
pardon?
Your voice is cracking.
Is it a problem for everybody?
No.
Yes, ma'am.
No.
No, ma'am.
No.
Yes, yes,
Good.
yes, yes.
It could be because it is raining in some places. So some places there might be an issue with network, but here also there is a mild drizzle. So I don't know. Okay. Anyway, the recording will be shared. So if you miss anything, you can, get it from the recordings. So as therapist, I think the most appealing thing for you should be the fact that you are able to treat the person as a whole and not an organ by itself in isolation. So in the first semester itself, you are taught the 5 energies, and you're taught the generation cycle, the control cycle. And that was something very exciting to me when I first learned acupressure, to know that organs are not separate. So they affect one another, so it is in a cycle. So you very often find that when there is a problem somewhere, the root is somewhere else. And that is why these treatments are very effective. So in this vast ocean, I would really say it's an ocean. Okay. I have been more or less, into it for the past 4 or 5 years. And yet I don't think I have absorbed even a very small part of it. So in this vast ocean, we will see where the color therapy fits in and how we can use it. So I put this slide just, to get you all interested, since you're all therapists. So I found this beautiful picture in a book by Dr. Anton Jayasuriya. He's a very, very famous Sri Lankan acupuncturist. And it's in the book Clinical Acupuncture. I've taken this picture from that. And he has done a lot of research in the field. And, he found this, what I'm showing you now, he found it in a museum in Sri Lanka. And this is an Asian elephant. Sri Lankan elephants are very similar to the elephants we have in India. And he found with these points.
Ma'am, audio and video both are breaking, ma'am.
Is it?
Everything is good.
No, it is not breaking.
No, ma'am,
Not
the voice
breaking.
is clear.
No. All clear sound.
It is very clear.
Yeah.
Totally. Clear sound.
I think it's the problem at your end.
Clear, ma'am. Very clear.
Yeah. Okay. So,
Madam, clear.
Yeah, fine. Thank you. So when he saw these points. So being a researcher, he wondered what this is. And then when he went to the elephant training centers, he was very surprised to see that these are precisely the points the mahouts and the elephant trainers use. One is to tame the elephant, and other is also to treat the elephant. Okay. And whenever the elephant is sick, they use these points to help the elephant to heal. Of course, they didn't know acupressure. I mean, those mahouts are not taught anything about acupressure. But over years by practice, they know that if you put pressure on these points or if you needle these points, then this elephant such and such diseases get cured. So I really loved this. And further he found, and some very interesting research he has done, he went back and he saw that such a mapping is not available for African elephants. You know, he did a lot of background and he did not find for African elephants. So they don't have this kind of taming exercises. And in fact, African elephants are very difficult to tame. Okay. Whereas Asian elephants, what we find in India, Sri Lanka, Indonesia, Thailand, and all are very easily tamed because every mahout instinctively is taught these points. And that is the reason why in wars, in olden days, only Asian elephants were used and not African elephants. Okay. So I just added this slide to tell you all that even in such a huge animal like an elephant, acupressure works. And definitely it will work for us. So those of you who are confused or who are wondering whether it will work or not, yes, it will. And I'm sure you'll be attending the regular sessions to know how miraculously different therapists are curing so many incurable issues. Okay. So now let's move on. Okay. So I'll just briefly a brief introduction to my concept of health. Of course, I have not invented it, my perception, I would say. So a natural status of well-being, when we talk of health, the first is physical health. Okay. So I should have no pain and my body should be fine, good enough for me to do all activities and so on. Okay. Let us say I have no pain, everything, but then I don't have the mind to do certain things. I don't want to do anything. So then immediately you will say, yes, it is not enough if I'm physically fit and I don't have any pain in my body.
पर भैया पानी मेरे को तो और थोड़ा सा तेज गरम करके ला दो पानी.
Madam Ji, will you please mute yourself?
नहीं हो सकता इससे.
Sangeeta Gupta Ji, kindly mute yourself. Yeah. So it is not enough if we are just physically fit, because we also have to be mentally fit. And we are social beings. We interact with people. You are a therapist. You want to interact with the people who come to you. So your social well-being is also necessary. You should be in a position to talk. You should be in a position to listen. All of them are important. And finally, spiritual. We started with this session with meditation, right? So when I meditate, I have made my mind empty. Ravindra sir told you, make your mind empty, make your thoughts empty. So what is left when you make your thoughts empty? So he says your consciousness, your awareness. So these are the 4 statuses or stages of health. And when we are young, physical fitness is very, very important. Mental fitness is very important when we start working. And social fitness is necessary when you move with people. And unfortunately, we think of spiritual fitness only when we grow old. So we don't even give a thought to evolving spirituality in ourselves until we are maybe 60 or 70. Okay, no problem. But then, as we age, I want you all to understand that a stage will come when your physical health will mostly deteriorate. In fact, if you open your treatise 1, in the first or second page, it is said, जो दर्द उम्र से होता है, उसको बीमारी नहीं कहलाते हैं. So, which indicates and which means that pain is a natural part of aging. So your joints will weaken and you will start getting pain. So you will definitely not have the same physical fitness you have at 20 or 40 at the age of 70, 80 or 90. Okay. And yes, mental fitness We may be very alert when we are young, but slowly you find that when you reach 60 or 70, you forget some things, and the enthusiasm you had to do may not be there because you are not physically so fit. And sometimes you are so disturbed, you don't want to talk to people. You just want quiet. I want some quietness for myself. So ultimately, when we age, you have to reverse this order. The spiritual fitness is what is going to become the most important. And then the social. So even if you're not physically fit, even if you're not mobile, are you able to smile? So you may have, I have seen many old people, some nurse or some attender is taking care of them. So they're not happy. They keep shouting at the attenders and they're not at all happy with them. So their social well-being has come down. So are we able to maintain our social well-being till the end? So can you see that this order is reversed as we grow older? And since I have just become a senior citizen, I give a lot of thought to this because I say age gracefully, and I want to accept that there are some things which come along with it. And what can I do to help myself and to help people around me? So this is my perception of, the general health. And health is not just defined as absence of disease or infirmity. That is not the meaning of health. Okay, fine. So again, this is a very beautiful slogan. Take care of your body. It's the only place you have to live, right? So we have to take care of your body. And as therapists, you have to make your patients understand that if they do not make some changes in their lives, in their eating habits, in their exercises, in their thought process, then magic, these magnets or acupuncture, acupressure, whatever you use will not work like magic. So I have people who complain, simple things only, gastric, severe abdomen pain, everything. Then when I say you have to walk a little bit, they say, they're not very old also, just 60s, physically fit. They say, I want to go for a walk, but I want a companion. And then my husband doesn't come out with me or my wife doesn't come out with me, so I don't walk. And then can you reduce or change your eating habits? No, I cannot do it. So what are you trying to do? You're trying to rectify, cure something in your body without you actually helping it to heal. So I always tell that a lot of healing takes place if we help our body to heal. So as therapists, I think it's very important for all of us to personally know how to take care of our body and also help our patients understand how to take care of their bodies. So two things are very, very important. One is the food they eat, and other is the way they exercise their body. So by now you all know, that all your acupoints are there on the hands and you can treat on the hands. So the first thing I tell people is start working with your hands. Nowadays, none of us have any use for our hands. We don't do any work with our hands, right? So I tell all my people, I say you cut vegetables, you do washing of vessels, and then you do kneading of your chapati dough, you make chapatis, you do everything as much work as possible with your hands and legs. So automatically your acupoints are all activated. Okay. Yeah. Okay. Now the heart of acupressure and acupuncture treatment, we all know, is the concept of energy, called as ki or kai or shai or chi or prana, what we call. So essentially, this is what makes us different from a non-living thing. Okay. We have what in physics you would say kinetic energy. Kinetic energy means the ability to do things. All living beings, any animal, even a living bacteria, how is it different from a table or a chair? Right. So a table or a chair also has energy. You can break it into pieces and extract whatever energy. But then we living beings have kinetic energy, dynamic energy. And that is why, we can heal any issues using energy. So do we need energy? Yes, we need energy for all our activities, including simply sitting and meditating. Even then, for that also, you need energy. And what gives you energy? This also you will know in your first semester. You say there are internal sources and external sources. What are the internal sources? That is what we call as the prenatal energy, the kidney essence. The prenatal energy is supposed to be associated with the kidney. So the energy you get inherently by birth from your parents. And external sources is everything. The food you eat, the fluids you drink, the air. So you find that, you're healthier when you come out of the city because the city is very polluted. And the cosmos, the entire cosmos is full of energy. The sun, the wind, so all your 5 elements, all of them. So they are all external sources. So your energy is internal and external. And anybody who has done even a little bit of science in school, I think the first thing we are taught is the net energy in the universe is a constant. It is neither created nor destroyed. Maybe that's one of the reasons why therapists feel tired. You feel tired when you treat a person. In the beginning, Ravindra sir addressed it. Why do I feel tired? Right? I cannot create any energy. So when I give some energy to somebody else, healing always is an energy transfer. Whether you use pranic healing, Reiki, acupressure, or even a doctor. So there is always some energy, healing energy, which goes from the person who is treating to the patient. So that's why not only therapists, any person who is involved in any type of healing normally feels drained. That's because I can't create any fresh energy. So how do I make up for the energy I have lost? Why, in the process of healing, since I cannot create any new energy, I take it from the cosmos. I take it from the cosmos. Okay. Now we saw this. You have energy inherited from the parents, which is called as the vital substance, the essence, and your food and your environment. And these are all the raw materials which help you to assess and assimilate the energy in your body. So what are the things which are important? The source of energy. So you eat processed food, the source itself is bad, right? And the way it is processed and the usage, how do I use it? Do I just go on pumping my body with energy and I don't use it? And how do I conserve for future use? There are people who work so much or who overdo things, and are not able to conserve the energy. So when you talk of energy, all these things are important. Now, ill health, can be due to energy excess, energy deficit, energy stagnation, and energy contraction. Contraction means it's in the opposite direction, like vomiting. The energy flows in the opposite direction. I'm sure all of you are aware of this. I just put it for completeness in the lecture. And this is also a very, very, very beautiful slide. I think you all will know this is your organ clock. This is your organ clock. And all of you, if you have children, grandchildren, or you yourself are working in the IT industry, you know that none of us work according to this clock. So a lot of health issues are because of this. So if you just see here, your lungs are most active from 3 to 5. 5 to 7 is your large intestine. So you have to get up and see that your bowel is cleared during that time. So some old people, they say they can't get up in the morning. because they don't get very good sleep in the night. And so they say they can't get up in the morning. I say you get up in the morning, drink some hot water, finish all your bowel movements, and then if you want, go to sleep at a later date, at a later time, at around 11 o'clock or so. Otherwise, including my parents, they all face constipation issues if they get up around 8 or 9 because of cold or because of weather or, because of old age. So normally, as therapists, especially as beginners, we don't share this with the patient. Okay. But now I do share it. And even if it's a small issue, I share it with the patients. And I say, as far as possible, try to, make your activities to fit this clock. So you will be healthier then. You will be healthier then. So I think all of you also, when a patient first comes to you, you can talk to them about this. And you'll find that a lot of problems are associated with improper activation of the organs, especially the youngsters. The time they should get up around 4 o'clock in the morning is when they go to sleep, and they get up around 11 a.m. Maybe after a few generations of working like this, the organ clock may change. Our body may evolve, but right now it hasn't evolved, right? Even when we are traveling, we'll have that issue. So please make your patients aware of this. Fine. Now, I think I won't spend too much of time in all this. So we know the organ pairs, lung, large intestine. The pairs are similar in both TCM and in your Ayurvedic acupressure. Heart and small intestine, liver and gallbladder. Here I am using the elements of Ayurvedic acupressure. And then kidney and urinary bladder is Jala, and spleen and stomach is Prithvi. Okay. So this is just a recap. This is just a recap because some of you may be, beginners. So elements plus what makes life, if anybody asks you, it is your key, it is your energy. So if you put a lot of, or even a dead body has all the organs, right? All the organs are there even in a dead body. The systems are also still there. It will be there for some time. But then there is no energy. The energy is gone, with what we call as prana. The prana is gone, right? So what makes us living, what gives us life is key. That is the energy, the life force. And you all know this. It follows, the energy flow follows your organ clock. The energy flow follows your organ clock, right? So starting first from 3 a.m., 3 to 5. So it is 2 hours. Every organ, the energy flow is maximum for 2 hours. So from lung, large intestine, then stomach and spleen, heart and small intestine, and so on. So now you can see what is different in our acupressure treatment is we close the loop. It is a loop. Okay. So when I put something in a loop, it means that it is closed. So anywhere the loop breaks, everything in the loop will get affected. Everything in the loop gets affected. And for me, I am basically an electrical engineer. So for me, this concept is very, very beautiful because in electrical engineering, anywhere you have a wire, where if the wire cuts, then there is no flow of electricity. Okay, there is no flow of electricity. And in my next 2 slides, we'll see how this electricity is actually flowing in our own body. So what essentially this diagram should tell you is that every organ is related to every other organ. And that's why when you see protocols, I was initially wondering when I saw the protocols, there is 1 point from small intestine, another point from UB, something CV, GV. So slowly you will understand why different points are chosen from different meridians. Okay. So this is what I told you. If there is a break, the loop is broken. So the energy flow is disrupted. We all know that. I have an indigestion. So stomach, spleen, something is affected. But then if your indigestion is very severe, I get a headache, I may get a fever, I may get breathlessness. Okay. And somebody whose lung is affected, after some time, they say that there is a problem with the heart. And people who have heart blockages, their lung gets affected, they feel breathless. So you can easily understand all that if you understand this loop. Okay, your generation cycle. Now let's start off from this slide. So all this was general and a recap. From this slide, we'll talk about color therapy. Now, as I told you, I am an electrical engineer. And for me, the best thing is that every single activity in our body is because of electric impulses. Every single activity of our body, of every cell, you have trillions and trillions of cells in the body. Every cell, the activity is because of electric impulse. So what it means is actually there are billions and trillions of very, very, very small electric currents. I think sometime or the other, most of us would have got a shock. So you know what the shock is. When you get a shock, you feel a tingling sensation, like something running in your body. So there are thousands, millions of them in our body, which are going on there every single minute, every single second. Okay. And all of us have seen a battery. I think you all used batteries. You have seen small batteries. You have seen big batteries. Okay. So when you want to take a battery for an application, you have what is called as a voltage. Voltage means it's like pressure. It is like pressure. So similarly, all the neurons in our body also have a voltage. Suddenly it struck me, maybe that's why somebody called it a cell, because batteries are also called as cells, right? So what in essence is every single cell of your body is a small battery. Okay, every single cell is a small battery, and your complete health of the cell depends on how it maintains this battery. The same thing, exactly like what is happening in a battery you put for a TV remote or for your mobile, the same kind of reactions take place. So this is around 30 millivolts. Millivolts means very, very, very small. It's a very small voltage. And we have many ions present in our body. That means they're positive or negative. They're positively charged or negatively charged. So what happens is, see, the essence, I don't know. I went into a lot of reading because I somehow could not even imagine how this acupressure works. I press somewhere and how it works. And having been an engineer for 35 years, I could not accept something without proof. We all look for proofs. Engineers look for proofs, right? And so I did a lot of work, and all this is a part of the research reading I got out. And then I understood how acupressure works. What acupressure does, I told you, every cell in your body is a small battery, right? So when I activate at some points, these small cells will send out impulses. What are these? These are electrical impulses. And it's like sending a small current. And this current will flow through some path in our body. And while this current flows through, it will set right some problems. So let's not go into too much of detail, but this is the essence of acupressure, acupuncture, your meridian concept, everything. So how do I first ignite the cell? How do I ignite the cell? So I have to give a stimulus. I have to excite the point. So how do I excite? Even if I pinch at the point, yeah, you feel the pain, right? So your nerves, your cells there, whatever is there below the skin gets excited. So what essentially we are doing in acute treatment is we are exciting the cells. So how do I excite the cells? Now I told you it's a small battery, right? So one way is needle. When I puncture, right, they get excited and they start sending some electric impulses. Or when I put a pressure, or when I use a magnet. So magnet, the small biol magnets we use, they all have magnetic fields. So they will affect, they will interact and they will affect. So it is fantastic. I have small thousands, millions, trillions of batteries in my body. Okay. And I have to ignite the right battery. I have to ignite the right battery. And this battery, what does it do? It will send some small impulses along the meridian pathway. And that is how whatever imbalance is there, it gets rectified. And so you see, when we talk of acupressure, we say energy is in excess, energy in deficit, all that you can explain in terms of the battery. And that's how it works. So far, so good. Now, your methods of stimulation, needles, seeds, magnets, pressure, light, color. So these are all the various methods we commonly use. Now, so I've just illustrated one point. That's all. One point, which is your K1.
मेकअप लगा हुआ है इसलिए
Anjali madam, please mute yourself. Anjali madam, mute yourself. We are
Yes. So you saw, I've just shown one point, K1. So you have like this different points. I'm sure you all know how the acu points are there. I'm not going into the detail of the meridian. So now we'll see how color works. So what exactly color, what does it do? So when I apply, where do I apply the color? I apply it on the body, right? I apply it on the body. So what happens? Just like when you needle, or when you put a magnet, or when you put a seed, the nerve cells below that get stimulated. The cells get stimulated. Now, I really could not understand what happens, but then slowly I understood the physics behind it, because the moment you talk of energy, there is a lot of physics in it, right? So acupressure, don't think acupressure is some sort of a magic. No, it's a solid science. It's a solid science, and you can find a lot of explanations for it. So why color works? That was my first question. Why does color work? So if you are a student of physics, or everybody we know, every color is associated with some energy. Every color, I repeat, is associated with some energy. So each color has a different energy. Each color has a different energy. So when I apply different colors, basically the energy I am sending to the point is different. The energy I am sending to the point is different. I'm sure there must have been thousands and thousands of case studies being done to arrive at the proper colors. Okay. And I will be in today's session, mostly I'll be dealing only with Ayurvedic acupressure, because that is something mind-boggling, right? So something we can totally relate and say it. Nobody can even make a claim on it, because TCM, they say, originated in China, though there is a conflict that it was in India, and the Buddhist monks took it to China. But as far as Ayurvedic acupressure is concerned, nobody can make a claim. We can all proudly say it is Indian and only Indian. Okay. So this is how the color works. See, the normal light we see is white light. Okay. And a white light has different colors embedded in it. Okay. I think there you all know. Yelu banna seri biliya banna vaitu. In Kannada we say that means 7 colors together make the white light. So as we would have taught our children to remember this as Vibgyor: violet, indigo, blue, green, yellow, orange, and red. Okay. So this is the order. Now each one of them has a different frequency or different energy associated with it. That's how it works. So basically, when you apply color, remember that you're actually directly operating with the energy. So when you see green color, let us say I'm seeing anything. I'm seeing a green table or a green pen or a patch of green or a green cloth. What it means is white light is falling on it. Okay. See, for example, now I'm sitting here, my tube light is white and you are seeing a pink color, right? So when you see a pink color, it means that this cloth is reflecting one part of the energy back. Okay, it is reflecting back. What about the other energy? So you see here, if you look at this diagram, green is sent back to your eye. That we call as reflection. It is sent back. Now, what happens to the other 6 combinations? They are absorbed. They are absorbed. Okay. So when you apply color to the body, so normally we say, colors work best when there is sunlight, because sunlight has all the colors. Sunlight has all the colors. So what happens is, when you apply a color, whatever energy falls on that part, some part of it is reflected back and some part of it is absorbed. So depending on the color, the amount absorbed and the amount reflected will be different. And so they have different effects. I think we all know this, the yin side and the yang side. And there are 2 ways. There are many ways. And 2 primary correspondences we have. One is the correspondence of the body on the hand. I have just taken it from Sujok. You have different correspondence. If you look at Ayurvedic acupressure, the first semester book, you have one based on Tulyartha, where you draw the diaphragm in the middle of the hand and you separate. And if you look at Dr. Vora's correspondence, it is slightly different. It doesn't matter. Okay, all of them work equally well. So let us see what this correspondence does. What this correspondence does is, it maps the different organs. It maps the different organs on your hand. It maps the different organs on your hand. And you will see, when you study in your semesters, you will see different protocols where they will say you apply green color on the liver correspondence. You apply some red color on the stomach and so on. You'll find some protocols like that. So immediately you should think of this diagram. Okay. So this is one. And today I'll be using this. This is at the back. This is on the yang side. So on the yang side, this also you would have seen in your first semester book. So this part is the cervical spine. And then you have the thoracic. And this is your bottom, coccyx. And then you have the sacral, the lumbar, and the higher thoracic vertebrae. So this is mapped on the yang side. Okay. Now, this is what we call as insect correspondence. This is what we call as insect correspondence. Okay. So I have taken a lot of protocols from various classes I have attended, and many of them, they use this correspondence, especially for children and all that. It is very effective. So we'll see some protocols with this correspondence today. So what is this correspondence? What does this say? It says that you have all the organs mapped not only on your palm, but also on each and every finger. That means you have the body correspondence on the palm and you have the body correspondence also on every finger. You have the body correspondence on every finger, right? So the way to look at it is like this, facing outwards. So if somebody looks at your finger from the other side, how does it look? So this is how it is. Now you can see that you have the lungs. So these are called as the phalanges. I think you all know the top phalange, the middle one, and the bottom one. So the top phalange maps the head region up to your neck. And then in the middle phalange, you have the lungs and the heart. And the bottom, you have the lower part of the trunk. You have the lower part of the trunk. And your hands are mapped here. Hands and legs are mapped at the sides, at the sides, at the sides. Okay? And your spine, the entire spine is mapped at the back of the hand. The entire spine is mapped at the back of the hand. Now you will see that you can arrive at some very beautiful protocols with this kind of mapping. And, I have taught this simple thing to people who don't know anything about acupressure, And they all say, they just send me messages. They have all used it, not for very major ailments, but they say it is very effective. So let us see how you can use this. Okay. And now we know the concept of tone and enhance. That is increase the energy and decrease the energy. That is sedate or tranquilize. So we have in Ayurvedic acupressure 5 physical elements and 5 metaphysical elements. That is Kal, Disha, Man, Atma and Tam. I think by now you all should know how to map the fingers, the energies on the fingers. So you see here, these are the numbers. So the same numbers are universally followed in all protocols, in everything. So 1, 2, 3, 4, 5 is your physical elements. 6, 7, 8, 9, 10 is Kal, Disha, Man, Atma and Tam. Okay. So recently I had a 4th semester student asking me how to remember. Very easy. This was taught to us by, this was taught to us by, I think, Anil Mishra ji. When we were in 1st semester, just hold both the hands together. Okay. The right hand thumb is 0. The right hand thumb is 0. And then I think start with the little finger. The right hand little finger is 1. And when you keep the hands together, the little finger of the right hand is in contact with the left hand little finger. So it goes 1, 2, and then 3, 4, and so on. So if you see, this is how it would be. And you can just do it a couple of times if you're beginners. 0, 1, 4, 5, 8, 2, 3, 6, 7, 9. So you just practice it, then automatically it will go into your head. And so now I know what are the fingers. So let us see what all we know now. We know the fingers, the numbers for each of the fingers. So these numbers directly indicate the particular energy. 0 means thumb. 1 means Akash. 4 means Jal. So these fingers directly correspond to the particular energies, right? And what do we now have to see? We have to see what are the colors we need to use for toning and sedating. So let us see that. So this is the chart, right? And again, you don't have to memorize it. You don't have to memorize it. There's a very simple way to remember. So thumb is what? Darkness. Instead of darkness, you can say it's absence of light. It's absence of light. Okay. So, and in fact, for creation, we need darkness. We need, for any creativity, you need darkness. And it is associated with black. So what does black color do? What does black color do? You will be using black color in so many protocols as you go through the semesters. Black is one color which doesn't reflect anything. All the light which falls on it, it will absorb. All the light which falls on it, it will absorb. So it will take maximum energy from light, black. Okay. So thumb is black and Atma is white. So just remember these two. Thumb is black and Atma is white. Then from Akash to Disha, 1, 2, 3, 4, 5, 6, 7, they follow your Vibgyar. V-I, this is blue actually. Blue, B-G-Y-O-R. Okay, this we all know. We all know from school. We have all learned Vibgyar. That is the rainbow colors, the 7 colors in the rainbow. And 8 is the only odd man out here. Man is pink. Man is pink. So these are the colors used for toning, for enhancing. Clear? Now for sedation, what you have to do, first, thumb and Atma, they are opposite, black and white. So if black is enhancing, white is reducing. So sedate. So to sedate 0, you use white. Similarly, to sedate 9, you use black. Okay, so we are clear with these two. Now, for the remaining ones, you just use the next color in Vibgyor for sedation. That means for toning 1, I use violet, right? So to sedate it, I use the next color in Vibgyor, that is indigo. So you see, you don't have to memorize. Just to remember black, white, anyway, it will go into you. Thumb is darkness, so remember black. Opposite of that is Atma, white, right? And then violet, Vibgyor, you know, pink. Pink is Man. So violet, you use indigo. Then 2, Vayu. Toning is indigo. The next color is blue. So for sedation, you use blue. Agni, toning is blue. The next color is green. So use green for sedation and so on. So if you just look at this chart, everything will be clear. You see, this is the next color. The next color is used for toning. Sorry, for sedation. Let me just take an example. If I have Prithvi, the toning color for Prithvi is yellow. These are fixed. These are fixed. The toning color is yellow. Okay. And the sedation color for Agni. Agni is number 3. Right? So this, to sedate, I have to apply the 4th color in Vibgyor. The 4th color is green. So to sedate, I apply green. So that way you can easily remember the colors. So I was very surprised that students, even in 3rd and 4th semesters, they were having a doubt about how to remember these colors. Okay, this is how I remembered and how I learned, and it's an easy way. And I think we all know this from Ayurveda. Vat is Akash plus Vayu, Pith is Agni plus Jal, and Kaf is Jal plus Prithvi. Okay, and you have, these are your phalanges, because you'll find it in protocols. That's why I'm explaining. So this is your first phalange, that is the top portion of your every finger. Then you have an intermediate phalange, and then you have a proximal phalange. This is your palm. This yellow one, the metacarpals, is the palm region. So you have, in every finger, you have the Vat phalanx, you have the Pith phalange, and you have the Kaf phalange. You have the Kaf phalange. Okay. And similarly, the first joint is called as the Vat joint, and the second joint is called as the Pith joint, and the third joint is called as the Kaf joint, right? And then I have shown here, this is what in protocols, in color, when you say nail chakra, this is how we color around the nail. This is called as nail chakra. This is called as nail chakra. Now, let me start off with color with a very simple example. If you look at your protocols, even in your first semester protocols, Ayurvedic protocols, in many of the protocols, you have 0 tone, 9 sedate. So for any infection, in fact, we were taught this as a thumb rule. You know, 0 tone, 9 sedate, whatever protocol you use in Ayurveda, you can always include this for any infection. And then, if you, let us say you have to use the 0 tone, 9 sedate in, say, some 4 or 5 meridians. So if you put, along with other points, so if you put magnets, you may be using some 40, 50 magnets. Clear? So the first thing I saw in one of Rizvi sir's lectures, that's when he told us, he said for 0, 9, use color. For 0, 9, use color. Very simple. Why? Most infections, the protocol is tone 0 and sedate 9. So if you look at this chart, toning of 0 is black and sedation of 9 is also black. Okay, sedation of 9 is also black. So all that you have to do is you have to put at those points, wherever you have to, tone 0 and sedate 9, you just have to put black sketch pens. Black sketch pens, you have to put black dots. In fact, during COVID, at all the infection points, at all the pith joints, they had told us you put, this is 0, 9. At the middle joint, you put black dots. Okay, so Colors are also very useful if you want to minimize the number of magnets, where you can help the patient to use colors along with magnets. Because from my experience, if you ask a patient to put more than 20 magnets, they stop after maximum 1 week. After that, they won't have the patience to do it. So they should have access to a therapist or some help to go and apply it to them. Otherwise, they all lose interest. So for me, the biggest challenge when patient is not nearby is how to give as less magnets as possible. So in such cases, you can use it with color. Okay. So now let's go on to some simple protocols. So to prepare a treatment, you need a protocol. So I'm going to help you how to make a protocol. So what is a protocol? The points which you have to stimulate and the way you have to do it. That is whether you have to sedate or tone, basically, and what color you will use. Okay, fine. So now I'll go on to my next slide. Yeah, is the slide visible?
Yes, ma'am.
Okay.
Yes.
Yes, ma'am.
Yeah, so let's go on.
Yes, ma'am.
Yeah. So I will quickly, I won't go through all these properties. Okay. So Akash is violet, and just understand that, you know, when there is less Akash means there is rigidity, stubbornness. So whenever there is rigidity, you experience a pain. Okay. So you have to increase tone Akash. And if Akash is in excess, what happens when there is a lot of space, flabby, things become loose. So like paralysis, prolapses, sagging of breasts, and so on. And the finger for Akash is the right hand little finger. And you know, the organs are lung and large intestine. Vayu is indigo, and the color is, indigo color is actually dark blue, dark blue. It has a drying effect. It causes movement. Vayu causes movement. So whenever Vayu is less, you have low activity, you have depression, insufficient muscular movement. So you can use indigo to tone. Where, which point we'll see. Now we are only seeing the properties. Excess Vayu means you'll have excess activity, instability. So because of excess activity, fatigue, anxiety, palpitation, increased pain. So to sedate, I'll be using blue. And the organs are associated with Vayu are heart and small intestine. Okay. Then Agni is blue. Agni has a heating effect. It will break. So heat energy always melts and breaks. And it will change the shape. It will change the color. So you can use it for melting blockages, clots, cysts, etc. And you can develop very simple protocols with this logic. And as I told you, for me, the challenge is especially youngsters, including my children. Their first thing is not more than 20 magnets, 10 on each hand. So you can use these yourself to make your own protocols. And the finger is left index finger. And then jal, water, cooling. Okay, its main property is stickiness. And when there is excess of water, you have edema, swelling, and you will have pain. So the toning color is green and the sedation is yellow. And very logically, the organs associated are kidney and urinary bladder. And Prithvi is yellow, stable, right, dense. And whenever there is a deficit, you have loose motions and then irregular periods, etc. And excess, again, you'll have lumps, tumors. And the finger is right ring finger. So just practice the fingers. Okay. In the protocols I am going to share, we are going to use fingers. Now, let's not go too much into all this. Let's go to protocols because I want to give you the feel for how to do the protocols. Okay. The man is pink. So man is very useful because that is the one which connects you to the external world. It's the mind. And I want you all to understand one thing. The mind does not know the difference between reality and imagination. Okay? The mind does not know the difference between reality and imagination. So if you imagine something wrong, the mind will think it is true. And the mind does not age. The mind does not age. With experience, your thoughts may change, but the mind does not age. So you'll find that You have to train what Ravi sir told you in the beginning. You have to train to control your mind, right? So whenever there is a deficit of man, you have insomnia, listlessness, and if it is in excess, then hyperactive. In fact, that's a disease in children nowadays. They say it's a disorder, hyperactivity disorder. They can't concentrate. They can't sit still in one place. And then the two beautiful ones, the concept exclusively used in Ayurvedic acupressure. One is the concept of Atma, Chetana. Okay. When it is in deficit, the organs will automatically die. Right? And when it is in excess, infections, everything can thrive. No? See, when the energy is there, when energy is in excess, everything can thrive. So that's why in case of infections, we sedate 9. We sedate 9. Okay. And the organs associated are the cortical brain, and the finger is the left hand thumb. And then the beautiful concept of thumb, black. It's the cause of creation. So in physics, anything black has maximum energy. So if you see black holes, there are some entities called black holes in space. They just gobble anything which goes their way, including any star, any planet, everything they can gobble. So it is the root of creation. Same thing, even in our Vedantic literature, they call darkness as the source of light. Darkness is the source of light, is the source of creation. So therefore, we create energy. So when you have infections, when you're weak, you tone 0, create the energy. And since it is related with creation, the reproductive organs are mapped to 0. So this is the organ pairs, what we already saw. And this is for your metaphysical elements. Now let's come to protocol. The first method you will use this I won't touch today. We'll talk about the second one, which is very interesting and works beautifully. And as I told you, from my experience, some people respond very well to colors. And so this is what I already showed you. And we'll see quickly in the next few minutes how to make a protocol. So what does this mean? So here I have shown you one finger, right? Now if I see all the fingers, so this is the meaning of the correspondence. That means you just look here, on every finger, I have the entire body mapped. On every finger, I have the entire body mapped. This is a very beautiful and a very unique way of looking at it. Right? Even in Sujok, they use this. And in Ayurvedic, also we were taught this. There is a book. There's a book exclusively on this. Okay. So this is the back. This is the yang side. And I have put the numbers here. Please remember the numbers directly correspond to the energies. You will be using that for protocols. So what do I know now? I know the energies associated with each of the fingers. And I know how the organs are mapped on the inside of the hand and on the yang side of the hand. This much I know. And I know the colors for toning and I know the colors for sedation. Everything is known. Right? Now let's go to protocol, some simple protocol. Supposing I have a pain anywhere. Let us say I may have a back pain or a cervical pain. Somewhere I have a pain or a knee pain. Right? So what is the meaning of pain in terms of energy? It's a blockage of energy. So what are the energies you have to work on? So first we saw that whenever there is pain, you have to increase Akash. Okay, so 1, I have to increase. Increase means tone. So what is the color I use? Violet. Toning of 1 is violet. And pain you can also get because of clots. Supposing I hit somewhere and there's a blood clot, I get a pain. Or there's a swelling inside, I get a pain. So whenever you want to dissolve, you will have to tone Agni. Right? Increase Agni so that it breaks. The clot or the cyst or whatever breaks, which is causing pain. And I have to reduce Prithvi because a clot or a cyst is a mass. So Prithvi has to be reduced. Now you just, after this lecture, you go open any of your protocol books. It will be very clear to you why the protocols are the way they are. Why they say tone 1, sedate 4, and so on. You can easily understand. And water retention also causes pain. right? Reduce gel, 4. Now, when a patient comes to you with pain, it could be any of these reasons, right? You try to see whether the pain is because of a clot or water. If you can't diagnose, safely you can do all this. Nothing, no harm. You increase 1, increase 3, reduce 5, reduce 4. Do it. That's all. Nothing will happen. Even though there is no clot, if you increase Agni also, nothing will happen. And excess air, excess of Vayu can also cause pain. We know a gastric pain is almost like a chest pain, right? So excess Vayu, normally the accumulation is in the chest region, in the trunk region, sorry, not chest, back, shoulder, everywhere you can have. So so what do I now know? I have a rough idea. If I have a pain, I have to increase Akash, increase Agni, and reduce Jal, reduce Vayu, and reduce Prithvi. These are the standard protocols. And if there is a nerve compression, reduce Kal and Disha. That's because of the way these elements are associated with the systems in your body. Okay. So now you see, for pain, I have a simple protocol. 2, 4, 5, 6 sedate, 1, 3, 7 tone protocol. Over. Just remember this protocol. 2, 4, 5, 6 sedate, 1, 3, 7 tone. The logic also I have explained to you, right? So now I know the protocol. So where do I apply? How do I apply? Very simple. So let us say, take cervical pain. Very, very common. Very common. And it can happen suddenly. Okay. I am not talking of chronic pain. I'm not talking of somebody who has a shoulder pain for the last 1 year or something. Let us say I have traveled by, I normally use color when people are traveling, because it's acute. Suddenly the pain comes. So I have found that it's very effective when it is acute, sudden, not chronic. Okay. So supposing you're sitting in a bus and traveling for 4, 5 hours and you get a pain, cervical pain. So where is the cervical region? So on the hand correspondence you have here, right? But you also have on every hand, every finger also it is there. So you see, what is my protocol? 1, 3, 7 tone, 2, 5, 6 sedate. Where do I, excuse me, my drawings are not very neat because these were not available. I made it. And so this line indicates it's the yang side. This is the nail. Okay. So the protocol, because why? The cervical region is at the back here. This is your neck portion. Okay. Here, this portion. See here. Here, this, in this, or if you look at the previous figure. Yeah. See here, it will be here, this region. Okay. That is the cervical region. So this is your first joint, upper joint, just below the nail, the joint below the nail. Okay. So you know the protocol. 1, 3, 7 tone, 2, 5, 6 sedate. You know the fingers also. 1 is Akash. I have to tone it. So I put a violet color there. I put a violet color there. 3 is Agni. Agni toning is blue. So you put a blue color on the cervical mapping. 7 is tone, Disha. So to tone, I put red. Next, 2, Vayu. I have to reduce. So what color I should put to reduce? I should put color number 3, that is blue. So on Vayu finger, that is on finger number 2, I put blue color. 5 is Prithvi. I have to sedate. So I'll take the questions after some time, sir. So to sedate Prithvi, I have to use, to sedate
Orange. Orange
Orange.
color.
Yeah, orange. Okay. So that way you got all the colors. And 6. So I have to use red. Okay, that is the 7th color. So you see how simple the protocol is. So the protocol, now you can make it as a standard for any pain. Now let me use the same protocol for back pain. Supposing somebody comes to you with back pain. Where is the back correspondence? It is here. It is here. Right? Now you need not bother. You need not bother about whether, you know, the pain is in the upper back, lower back. After all, you have to take a color and put it. See, when you put magnets, you know, you may have, we want to be precise because you may need to use more magnets. if you're treating a larger region. Whereas in color, it doesn't matter. So wherever the back pain is, upper back, middle back, lower back, this is the entire back correspondence. Okay, this is the entire back correspondence on all the fingers. Now let us keep the same protocol. 137, tone 256, sedate. Now the numbers are the same. The protocol is the same. So the colors remain the same. The colors remain the same. Right? Only where I apply it is different. Why did I apply it from here to here? This is the back correspondence. This is the back correspondence. I have used the same color I used for the cervical pain, for the back pain also. Got it? So very simple. Now, you can all just try this. We can discuss this tomorrow. What will you do for knee pain? What will you do for knee pain? And what will you do for stomach pain? Okay. So why does stomach pain normally come? You think of that. And then, so what protocol you will use? So you know which elements to enhance, which elements to reduce, you know, all that. So you think of it, you yourself think of a simple protocol and what colors you will apply for this. For example, if you have stomach pain, normally, you know, you reduce Agni. You reduce Agni. Okay. And then increase Jal, because you will have, you know, a lot of gastric problem. You can increase Jal. And where will you apply this? Go to each finger, finger number 4. Okay, finger number 4, you have stomach. There to increase gel, what will you use? Green. So use the green color. Okay, and finger number 3, the stomach correspondence, reduce Agni. Again, you will use green. Again, you will use green to reduce Agni. So you see, you can make very simple protocols, and trust me, it works. At least for me, for something which happens immediately, it has given very good results, even in adults. But for something chronic, I mean, which has been there for some time, some people respond quickly, some people don't. They don't respond so quickly. Now, these are some standard protocols, okay, for anger. So there is 2 and 7 sedate and 1 and 5 tone on the yang brain. So now, if you just know the protocol, you can easily apply. So this 2, 7, 1, 5, now remember, if you are using a joint or a meridian, the points are different. Here, I am not using any joint. I am not using any meridian, vertical, horizontal, or no pith joint, cuff joint, nothing. What am I using? What do these 2, 7, 1, 5 stand for? They stand for the finger numbers in this particular way of treatment. Not always. In this, what I'm showing you now. So here what happens, it stands for the fingers. And the region, the yang brain, you know where it is. So use the color to tone or sedate corresponding to the number on that particular finger. Okay. So cold and cough. This many people have used for children and they have said it works very effectively. It works very effectively. So 3, 6, 7 tone, 2, 4, 5 sedate. Even if you don't want to do all this, you can just do 3 tone and 4 sedate. That itself will be good. What is 3? Agni. So whenever you have a cough, cold, etc., increase the Agni and reduce the Jal whenever there is congestion. So it works beautifully for children also. Okay. So where do I do it? You do it on the lung correspondence. Do it on the lung correspondence. Okay. So on finger number 3, on the lung correspondence, you use the color for toning 3, that is blue. Similarly, the others. Okay. So, and this is how you apply. So this is the lung correspondence. So you apply the respective colors. In fact, I tried, you know, I have given this to a few of my colleagues' children. So they're all in 6th standard, 7th standard. Now there are 2, 3 children who do it for their friends. It's so simple, colors. And they do it for their friends. Normally in school, somebody says they have a cough or something, you know, they do all this, headache or something, they treat. So it is that easy. They don't have to know anything also. They don't have to know the theory or anything. So I think the rest of it will take, these are all protocols. I'll just discuss it. These are available in the book. And we'll just discuss tomorrow this, and then how to use colors on chakras tomorrow. And now I think I will open the session for any doubts if you have.
Ma'am, we'll get the PDF.
I'll give you the PDF. I'll give you the. I'll send it to Ravindra sir, and he can share it with you. I mean, I think it can be put up with the groups. I'll give the PDF. I think the recording will be shared or something. We'll see how to do it.
Good evening, madam.
Yes. Yeah.
I doubt that you explained that only color therapy will works on only in daylight. What about the night and artificial light?
Artificial light also fine. See, like tube light and all, they have all the visible spectrum. Okay.
Yeah.
But at night, you know, you don't have the visible spectrum.
Hello, ma'am.
Okay.
So that
Hello.
that frequency of wave is not available in the night.
Okay.
So it may not be, it won't be very effective unless there is some stray light coming from somewhere. So it is
Okay.
artificial light also no problem. Tube light and all, they all are, you know, or even CFLs, they all emit light. All the visible spectrum is there. See, please understand, when we are using color, we are dealing with the visible spectrum. What we can see,
Okay.
the colors we can see. So normally,
Okay, ma'am. Another one, ma'am. Once a patient is having a lumbar disorders, what is the color for lumbar disorders? Lumbar
see,
pain, ma'am.
back pain. I just showed, no, that is for back pain.
Ma'am, lumbar will be come on the palm, back of palm, not in a finger, no, ma'am. Lumbar part, lumbar
See,
bone.
that's why I told you here, in this way of treatment, there are two things. What you told is
Yeah.
correct. That lumbar is the correspondence of the entire body on the full hand. That is called as a body correspondence on the hand. Okay? You can use that.
Okay.
Okay, so you know from here, this is your lowest part of the back, you know, the coccyx, and then from here and here, right? This mapping is there. You can use that. You can use seeds also if you want. I mean, if you don't want to, if you want to use correspondence. Correspondence is one way of doing it. That is one way. That is the body correspondence. Along with that, you can also use the finger correspondence. What I showed just now.
Okay, ma'am.
So in this mode
Okay.
of treatment, what we are doing, we are using the insect correspondence. That is the mapping of the body on all the fingers. So when I say
Okay.
tone 2 means take finger number 2. Okay.
Okay.
Finger on finger number 2 at the back correspondence, you put that particular color or for toning or sedating or whatever is the protocol.
Okay. Thank you, ma'am.
Yeah, there are two
Ma'am.
different ways of correspondence.
Ma'am,
Yeah.
Ma'am, you have explained the concept very nicely and it is very interesting to learn from you. I just have a small doubt over here. When you say 137 tone and 256 sedate, you had used the Vath joint. So any specific reason and not selected
which
other?
which one?
137 tone and 256 sedate.
For which?
This protocol you just mentioned, it is for pain.
No, that is general. See, that one, that is a general protocol. You have to get the correspondence, and in that particular correspondence of that particular fingers, you have to apply those colors.
That is for
So here
cervical,
when
she
we
has
are
said.
doing, can I please finish this first, ma'am? Please.
Yeah,
Thank
see,
you.
1 minute, let me
When-
complete. 1 minute. See, that
Sure.
protocol is a general protocol for pain. Okay?
Okay.
So the numbers correspond to the finger numbers. Okay? And if you have cervical pain, apply those colors on the cervical correspondence of the corresponding finger. If you have back pain, apply it on the correspondence of the back on that finger. If it is for cold, apply it on the lung correspondence. If it is for stomach, apply it on the stomach correspondence.
Okay. So here, where the confusion came from is for pain, you said 137 tone. So you were applying on the respective Vath joint.
No,
So in that PPT, on the PPT, you
wait,
had.
let me share the second PPT.
It is not what or it is correspondence.
This is correspondence. This is not what. This is the correspondence. See here. See here. The
Not
lung
this one,
cons-
ma'am.
This one?
No, not even this, the previous one, ma'am.
This
The
one?
previous
It is
one.
This
lung
one?
correspondence.
Oh, yeah, this one,
Like
this one.
This is where the cervical correspondence. Look at this.
cervical.
That is not the jaw. This part, this is your cervical. No, you can see here. This is where it starts, right? The spine starts from here. So what I put there is this one, the cervical correspondence point. So you
Yeah,
can't
this is
just put one
perfectly
point,
okay,
no?
but
So
when
you
referring
don't
to
put
the-
one point. So you just draw a horizontal line there. That's all. For the
Okay,
back,
nicely
for the
explained,
back,
ma'am. Thanks.
understood? Yeah.
Yes, ma'am. Thanks a lot, ma'am. And one
Okay.
small quick question over here is, I will be interested to know if you have completed the correspondence course or you have completed the campus course.
No, I'm doing distant only. I'm not doing on the campus.
Okay. Thank you, ma'am. Thanks a lot, ma'am. Interesting session. Very nice.
Ma'am.
Thank you, ma'am.
Okay.
Ma'am, can
Ma'am,
I
for
know?
ligament, ma'am, for ligament,
Yeah, one of you.
ligament tear, what protocol we have to use?
For what?
Ligament tear on shoulder.
We'll see some more protocols tomorrow. Today I just gave you the logic. We'll see.
Ma'am,
And
how
it-
can we balance the Vata dosh?
What is what? You see what?
Vayu and Akash.
Huh.
So Akash tone, Vayu is a dead.
Yes.
Okay. And Agni also we can tone, ma'am?
Yeah, Agni you can tone. If there
Because
is
in
excess,
Ayurveda, when you do
yeah.
Panchakarma, they do with heat and massage.
Yes.
So what is ideal to remove Vayu dosh? How we can?
I mean, I don't know about Panchakarma. I'm not very sure of
With
that.
Vata dosh, how to harmonize the
See,
Vata.
here you have to deal with the particular symptoms and then do it.
Okay.
See, because
if
you
there
are
is
not
pain,
see, you're
pain
not
due
taking.
to Vayu.
No, that's what, man. See, here when you take a medicine, it is general, right? But here you're doing it specific to the location of the pain or the problem with a particular organ and so on. So from that you have to prepare the protocol because I'm not taking a medical. See, for example, if you have a pain, let us say you have a headache or a pain anywhere, you take the same painkiller. Now, one ibuprofen will be given to you, right? Yes. So when we take a medicine, yeah. But here, if you want to treat using acupressure, you have to know where the pain is. Unless you use some general point.
No, but ma'am, in Vayu dosh, yeah, I got your point. But Vayu dosh is in everywhere in the body. The whole body is paining. You have rotating Vayus here and there. So then can we do on yang brain?
Brain, I don't know. I'm not sure. Let me think over your question, or maybe Ravindra sir, if he's there, maybe he can answer. I'm not actually. No, I think he's not there. Okay.
Okay, fine.
No, you can easily treat on Y finger. That's all.
On general finger number 2.
In general.
Yeah, but if there is a general Vayu dosh, Vata dosh in the body.
Yeah.
Then we treat on yang brain, is it?
No, don't worry. On Vayu finger, top phalange, top joint, what joint itself is enough. It will take care of the whole body.
Okay, the Vata joint. Okay, fine.
Yeah.
Got it.
Like
on
that,
Akash,
each finger, see, for example, cervical pain.
Yeah.
2, 4, 5 red. Whatever the protocol she has given, no.
137 tone, 256 a day.
137 tone. In finger number 137, on cervical, what is the finger in a color of 1? At cervical point, you shown that.
Yeah, that's what I told you.
I got, but general Vata dosh ho to kya karna hai? Where to put?
Vata or Pitta or Kapha, Vata means air and space.
Yeah.
Okay. So, what is the meaning of air and space? Which finger represents air and space?
Both small finger.
Yeah. In Vata joint, you go and then, you can treat, no?
Yeah, but where to treat? The Vata joint, you mean to say?
Vata joint.
Okay. Okay, got it.
You
Fine.
have the Vat, Pitta, Kapha joints, right?
So I'll treat on the Vata joint if there is a Vata dosh overall in the body.
Yeah, it will take care of the whole body.
Okay, thank you. Okay, thank you, sir. Thank you, ma'am.
Yeah.
It was wonderful lesson.
Yeah.
Excuse me, ma'am.
Ma'am,
Ma'am,
can you
please,
please share the Vayu
can
Prithvi and
you
Disha
show once again the slide for the knee pain?
No, I have not put it. I want you to do it.
Okay.
Ma'am, can you please share the Vayu Prithvi and Disha slides, please?
Yeah. I will send the PDF.
Thank you, ma'am.
Ma'am, I have a question related to this Vata Pitta Kapha as well as the correspondence toning off on the finger joints. So my understanding is like Vata Pitta Kapha and corresponding joints, are they very related? For example, from the place where the cervical starts and the end of the base. So do we define it like the first joint or whatever it is falling under, it is Vat, and second it is like if it is lungs and so then it is Pit, and third if it is falling in the large stomach or so then it is Kaph. Is it something like that?
Yeah, something like that. The
I just want to
correspondence has been
understand.
drawn something like that. Yes, on the phalanges.
Okay, so on the phalanges where we say Vata Pitta Kapha and the correspondence where it is following as
That
like
is what
the
is
body
normally
structure.
associated with these elements.
Okay,
But
so it is normally associated.
with the organs we have to do on the back of the finger or front side of the
Organs
finger?
are on the front. The back is
Or
at the end.
organs.
Yeah, I've shown no inside is the organs. Yang
Yes.
side is the back.
Okay, thank you, ma'am. Thank you for
Yeah.
clearing this.
Ravindra sir, shall we close the session?
Yeah. So friends, on behalf of every one of you, I express my thanks for the wonderful session rendered by our beloved Professor Umarao. It was, very useful information in the simplest possible manner. It was conveyed. Class was fantastic, and we'll catch up again tomorrow at sharp 7 o'clock. And if necessary, we'll see how best we can take you for second level also in the days to come. So thanks for all the participants also for making this a good success. Thank you, friends.
Yeah. Thanks to all of you. See you tomorrow.